Hi, I'm Jenny Sukov, and I'm the editor of EverydayHealth.com. This month is Women's Health Month, and we're focusing on some really important and really exciting innovations that affect women. One of the most important things that women can do to have a healthier life is really control their weight. And I've got a new book out. It's called Everyday Health, My Calorie Counter. It's a great tool to help you control the weight you're at or lose weight if you need to. And if you start to lose weight, you can reduce your risk of developing type 2 diabetes, cancer, osteoarthritis, and high blood pressure, which is a leading risk factor in heart disease, which is the #1 killer of women. So there's some recent research about how cholesterol levels in women are actually affected by a woman's menstrual cycle. And that's really important information because we know that women present the symptoms of heart disease differently than men. And now we know that their cholesterol levels are also particular, and that really helps doctors diagnose and treat that problem. Breast cancer is a huge issue for women. It affects 200,000 women every year. But there's new CT scanners that are incredibly powerful, and they use 3D imaging technology to detect tumors that are as small as 3 millimeters, which is about the size of a head of a pin. So that's really helping in early diagnosis there. Fibroids are a condition that 1 in 5 women will experience in their lifetime. And in the past, you may have had to have a hysterectomy, which might have meant weeks of painful recovery and very large scars across the abdomen. But there's new surgical techniques called Da Vinci robotic surgery that really minimize the scarring, and they can minimize the time that you stay in the hospital. So it's really terrific advances for women. Osteoporosis is also something that a lot of women are concerned about and should be concerned about. And the good news there is there are new drugs coming down the pike that focus on increasing your bone mass, not just preventing bone loss. And finally, gestational diabetes is something that every pregnant woman needs to be concerned about, because if you develop it when you're pregnant, both you and your child run the risk of developing type 2 diabetes later in life. And the American Diabetes Association recently adjusted its testing guidelines. So now every pregnant woman gets a sophisticated level of diagnostic testing to help her find out early if she is susceptible to gestational diabetes. So for more information on this and all other health innovations, go to everydayhealth.com, and you can also learn about Women's Works, a host of free events all around the country this month at hospitals. Go to everydayhealth.com and find one in your local area.